What is your ideal doctor-patient relationship?
I can feel comfortable enough to be able to talk to my doctor and tell him everything or anything.
The partnership where the patient kind of sees me as the medical expert, but they're still fully engaged in their own health outcomes, and so they're motivated, and they definitely either want to maintain good health or improve upon any health challenges that they might be having.
Do you feel comfortable sharing your concerns with the doctor?
I have personally lost people in my life because of not being able to share. I know that I can come and speak to him about those things, and two, again, having experienced those things happen to people that I know that were close to me.
How do you develop a relationship with your patient?
The one thing I like about being an internist is that, I don't have to do everything at the first exam, so we can build a relationship together. Taking interest and finding about some of the things they like to do, finding about their lifestyle, their families, what traditions they may have, what concerns they may have, and then just kind of building trust that way as they get to know me and then I get to know them.
Can you give an example of a negative experience with a doctor?
If anything is wrong, they'll say, here, take 800 ibuprofen, call me in the morning. Only reason why you're doing this is so that when I run my insurance card, and that's the only reason why you want me to be here.
Describe how a patient did not follow your care instructions.
In the African American community, it's called sugar diabetes, and so that's such a sweet term that it's hard to think that that can cause so much damage to your system. So really just trying to get them to understand that it's not just about the blood sugar, that it is about all of the things that's happening to your vascular system because of these elevations in the blood sugars.
Can you give an example of a positive experience with a doctor?
If there's an issue, minute, large, whatever, always, willing, ready, available to deal with it, address it, take care of it, and we try to do it in the most invasive way. Do it as easy as possible, and then if you got to build onto that, then so be it. But to make things as comfortable as possible.
Describe how a patient did follow your care instructions.
When I get a patient who finally gets it, understands how their diet, how their exercise affects their diabetes and their blood sugar readings, that's when we really start to see major changes in their control and improvements in their outcomes.
What strategies do you use to get patients to listen?
I kind of start out with what their concerns are, what fears they might have, what experiences they've had in the past regarding either the healthcare system in general or their own medical conditions, and then telling them, why I'm instituting the therapy that I'm instituting and why I think it's important, and hoping that, again, they continue to ask questions and feel more comfortable.
How do you get your doctor to listen?
I just talk to them. If I have an issue, I need to talk to him about something, then the ear is always there. There's never I've never had an issue or a problem getting him to pay attention, to listen, number one, or to pay attention, or to give sound advice for whatever the situation might be.